Good afternoon. Thank you so much for joining us. I know people are coming into the Zoom meeting. We'll let you come in for a moment, but we are very excited to host our first patient education and empowerment webinar series for 2023, and how appropriately we're starting off with Black History Month. We think that's very important to honor our ancestors. So we are going to be talking about today why genetic testing is important to your health. My name is Colleen Allen. I am the Vice President of Sisters Network Incorporated. Again, I thank you and welcome you to our Black History Month, Why Genetic Testing is Important to Your Health. We will be having a wonderful presentation from Tatiana Garrison Johnson, who I will be introducing in just a moment, but we're going to let a few more people get into the Zoom meeting. We are excited to have you today. And again, my name is Colleen Allen. I am the Vice President of Sisters Network Incorporated. If you don't know much about Sisters Network, let me tell you a little bit about us. Sisters Network is the only national Black breast cancer survivorship organization in the country. And Bridget, if you want to pull up the flyer for Sisters Network, the at a glance, that would be great. But we are headquartered here in Houston, Texas. We are a national organization, and we were founded in 1994. We have chapters around the country that are serving and supporting women who have breast cancer, or just educating the community. Bridget, do you have that flyer for me? Anyway, so Sisters Network, as I said, is headquartered here in Houston, Texas. We were founded in 1994 by Karen Eubanks Jackson, who was a 4-time breast cancer survivor, 29 years to be exact. And so we have been around for, celebrating nearly 3 decades as the national leader in the Black breast cancer movement. And here you can see our mission is Sisters Network is committed to increasing local and national attention to the devastating impact that breast cancer has in the African-American community. Our national creed is in unity, there is strength, in strength, there is power, in power, there is change. And that was something Mrs. Jackson coined back in 1995. And as you can see, there's our wonderful chapters that we have around the country. I'm sure a lot of them will put in the chat that they are in the house today, and we will definitely recognize them because they are the boots on the ground for this organization. And this information is on our website. Again, Karen Eubanks Jackson is the founder. And if you want to learn a little bit more about Sisters Network, you can always purchase her book that tells kind of the story about Sisters Network. It's called In the Company of My Sisters, My Story, My Truth. And I think we have a copy of the book to share with you. Bridget? Here we go. And it's available on Amazon. It's a wonderful book that kind of chronicles how Sisters Network started, Mrs. Jackson's own personal journey, and just about, the sisterhood that she found in founding this organization. Again, you are watching Sisters Network Incorporated, the genetics testing webinar. It's why it's important to your health. We'll get to that in just a moment. A few more housekeeping things. I want to just tell you, we've got some exciting programming coming up for 2023. Just a few things that are coming up in, April. We have the Pink Power Tour, and I believe we have a flyer for that, where we will be going around to 5 cities, and we're super excited. We're kicking it off in Charleston, South Carolina, which is one of our new chapters. We will be talking about triple-negative breast cancer. We had this tour last year, and we did 5 cities, and we were very excited and very well received in Dallas and Detroit, in Milwaukee, in Durham, Raleigh, North Carolina, and in Chicago. And so we are looking forward to coming back, starting, like I said, in South Carolina on April 1st. So if anybody's in the South Carolina area, please take time to register. This flyer is on our website. We are very excited to continue that tour, and we will be going to, again, April 1, we'll be going to Charleston, South Carolina. Then we'll move on to Orlando, Florida, July 15th. Nashville, Tennessee, Saturday, September 16th, Montgomery, Alabama, October 21st, and then we will go to Washington, D.C., and that date will be announced. We have chapters in all of those cities, with the exception of Washington, D.C., the DMV area. We do have 2 chapters in Virginia, but no chapter in Maryland or Washington, D.C., so we are always open to a lady or a group of ladies, rather, who would be interested in starting a Sisters Network chapter in that area, because we believe it's an important area to have presence in. Another thing that's coming up that we have is the walk. Our April 29th, we will be hosting our Stop the Silence National African American Breast Cancer Walk here in Houston, April 29th. We encourage everybody to come out, come to Houston, have a lot of fun, the sisterhood. You can see the camaraderie. It's a beautiful walk. It's been held, this will be the 13th year. Portion of those funds are raised that go to our breast cancer assistance program, the Karen E. Jackson Breast Cancer Assistance Program that has been around since 2006, where we provide financial assistance to survivors around the country, as well as pay for mammograms and or ultrasounds should someone need it. So we are very excited to host this event. It will be at the University of Houston, the Central Campus. Please visit our website or go to stopthesilencewalk.org, which is the official walk website, to learn more. And then I think there is a little bit more that I just want to touch base on. We have coming up, is it the, we have an Instagram Live that we'll be doing in March. I don't know if anybody watches the, what it's called, Love and Marriage Huntsville, but Kimmy Scott has been very vocal about her recent diagnosis with breast cancer, and she actually is with TNBC, and she'll be talking about her breast cancer journey and conquering the storm, as she calls it. So we're very excited that she is lending her voice, and she's been very generous with a donation to Sisters Network, but she just wants to shed more light on breast cancer, her personal experience, and empower and educate women and encourage them to get their mammogram. So we thank Kimmy Scott for wanting to share her story and being so transparent, not only on her show, but now coming on the IG Live with Sisters Network. So please make sure to tune into that. We will be sending out a reminder for folks to get involved. And then finally, we have coming up in October, we will host our National Black Breast Cancer Summit here in Houston. It will be October 6th through the 8th. We'll have more details, but all of this information will be on our website. It is the only National Black Breast Cancer Summit, and we will be focusing on, of course, health equity, education, and advocacy. We will have major medical experts that will be on hand to share their knowledge, and that we'll have the sisterhood, we'll have the camaraderie, the survivorship. And so we just welcome everybody to come. So let's get to the business at hand today. Again, thank you for joining us. My name is Colleen Allen. You are watching our Black History Month webinar under our Patient Education and Empowerment webinar series. Why genetic testing is important to your health. And we thank our generous sponsor, Merck, who has been very, very supportive of sisters in so many different ways, and with this webinar, but in other outreach opportunities. So we thank Merck for being our partner and friend in sharing information with the community. And also our strategic partner, our national strategic partner, For the Breast of Us. I'm not sure if anyone is on today from The Breast of Us, but we thank Marissa Thomas, who is one of the founders of The Breast of Us, and April Finley, who's kind of her partner in crime, who's very supportive to help us get the word out to their stakeholders. So we welcome any of the For the Breast of Us members, ambassadors. We appreciate your partnership, and we appreciate your attendance today. So without further ado, I am going to introduce our special guest today. This is our first time having her, so she's now part of the Sisters Network family, as I told her earlier. A beautiful young woman. Her name is Tatiana Garrison Johnson. She most recently was a cancer genetic counselor at Beaumont Health Cancer Genetics Program in the Detroit area, and we have a Detroit chapter. But in March, she will be joining the Winship Cancer Genetic Counseling Program at Emory University Hospital in Midtown in the ATL as a genetic counselor there. So we do have a chapter in Georgia Tatiana, so we'll make sure that they connect with you. Tatiana received her Bachelor of Science in Biology from the Howard University in 2019. She then received her Master of Medical Science in Human Genetics and Genetic Counseling from the Genetic Counseling Training Program at Emory University School of Medicine in 2021. It was her personal experience with her mother's breast cancer diagnosis that sparked her own curiosity in genetics, which led her to the field. Tatiana is passionate about serving underrepresented communities and has done so through mentoring, tutoring, and various volunteering. Tatiana, thank you so much for being here today, for sharing your expertise with our audience. And I know that they're going to have lots of questions because they usually do for our wonderful presenters. So I will yield the floor to you, and I believe Brigitte will let you share your screen. Thank you so much.
All right, perfect. Thank you so much for that introduction. I'm happy to be here with you all today. So let me go ahead and get started sharing my screen because I have quite a bit of information for you all today. All right, so can we see that okay?
Yes.
Okay, perfect. Alrighty. So once again, the name of the webinar today is Why Genetic Testing is Important to Our Health. So I have no financial interests or conflicts to disclose today. So just as an overview, I just want to take you all through through bullet points here today. So I'll be going over the background, just some general knowledge, as well as then I'll go over what in fact does make a family history suspicious. What are the testing types that you all who have been diagnosed with breast cancer may have already heard of or undergone, and what is the difference between the genetic testing process and maybe what you've already done. And then ultimately, I just want to walk through how we talk to our family members about their health and how ultimately that helps us when doing genetic testing. Okay, so just some general background information. Breast cancer, as you all may know, is the most common cancer among women worldwide. But of those breast cancers that people get diagnosed with, only about 5 to 10% of breast cancers are hereditary, which I'll walk through that. Black women have a higher incidence of early onset breast cancer, meaning like before the age of 50. And that's one of the things that make us suspicious for a family history when doing genetic testing, and I'll go over that. And Black women are 2 times as likely to be diagnosed with triple negative breast cancer, which you may be aware of is a more aggressive type of breast cancer. And I'll walk through how that relates to genetic testing as well. And with that being said, because we're more likely to be diagnosed with triple negative breast cancer, that's one of the reasons that we have a higher mortality rate than some other populations. And then with all those facts being said, we're still less likely to undergo genetic testing. So different studies have shown that, and that could be for several reasons, maybe because, it's not being offered to us. We've never heard of genetic testing. Maybe we're hesitant about undergoing genetic testing for historical reasons or personal reasons or whatever have you. But we're less likely than other populations to undergo genetic testing. So I just want to walk you all through some information that may be your first time that you've heard about it, or you may have heard about it but not have undergone it. And I just want to provide you all with some information. So there are major breast cancer risk factors in general that can contribute to developing breast cancer. So in general, one of those things would be gender. We talked about how breast cancer is one of the most common diagnosed cancers amongst women. Age is also a risk factor. Usually, we see cancers in older ages, meaning those over 50. But then one factor would be personal history. So those who have maybe already had a breast cancer diagnosis, they're at a higher risk than to develop another breast cancer rather than somebody who's never had a breast cancer before. Or maybe somebody who's had to undergo a breast biopsy but has came back with an abnormal finding that wasn't breast cancer, but does now put them at an increased risk. So maybe those who were diagnosed with like a atypical ductal hyperplasia or a lobular carcinoma in situ, which just puts them at high risk to develop a breast cancer. As well as there may be other risk factors that just ultimately put women at a risk to develop cancer in general, with that being breast density, maybe age of when we first got our period, or age in which we gave birth, or just other risk factors in general that contribute to one's cancer risk. Family history is also a risk factor. So if there's already been breast cancer in your family before, can put you at a risk once it's in one's family. But then ultimately, I'll be going over when those have a genetic susceptibility to getting breast cancer. And those are people who have an alteration within their genetic makeup that then put them at an increased risk to develop cancer. And I'll walk through that. So ultimately, what makes our family history suspicious? So some things that raises my eye to someone who would qualify for genetic testing would be those who are diagnosed at a young age. And so I would consider anybody diagnosed with breast cancer under 50 being suspicious. When we have 3 or more people in the family with the same diagnosis. And that also includes when multiple generations are affected. So maybe you have breast cancer, your mom had breast cancer, your grandmother had breast cancer, or just in general, you've seen it in a relative in every generation, somehow, in some shape or form. When certain cancers are occurring together. I'll mostly be focusing on breast cancer today, but we know that there are other types of cancers that could occur when one maybe has a family history or personal history of breast cancer that raises our suspicion. So cancers like ovarian cancer in one's family or diagnosed with that. Prostate cancer, which is a cancer that we would see in males. Or other types of cancers, maybe certain like types of stomach cancers, melanomas, and then even other types of cancers. And that includes more rare types of cancers, like pancreatic being one of those. Or ultimately, it can honestly depend. And one of the things that you could do to, see whether your family history is suspicious is really to talk to your healthcare providers, or if you were to meet with a genetic counselor, which I'll go over as well. So I just wanted to give some family history examples. These are just some examples of a family intake that I may take and may see when I see a suspicious strong family history of cancer. And so circles would be females and squares would be males. And let's say the person, the shape that the arrow is pointing to would be you. So you may not have a personal history of cancer yourself, but in this family history on this person's mom's side, we see that there are several cancers within that family tree, starting with a grandfather with prostate cancer, a mom having 2 different types of cancers, one being fairly young with that breast cancer, and then ovarian, and then seeing breast cancer in her brother as well. And so once again, one of those things that do make us suspicious is when we do see males diagnosed with breast cancer. Not saying that can't happen, but it definitely raises our suspicion for a genetic mutation when we do see that in one's family history. So another example would be this person, they're diagnosed with a young ovarian cancer, and then we see several other cancers, once again, in each generation, as well as pretty much everyone in this family history was diagnosed with some type of cancer at a fairly younger age. Okay, so what may be the testing criteria for someone with a breast cancer diagnosis? And so not saying anyone can get genetic testing, there just are certain criteria that may make one's one, a suspicious, which I went over, as well as what may qualify insurance to cover for the cost of testing, which we'll talk a little bit about costs more later as well. But just in general, once again, so anyone with a breast cancer diagnosis who is diagnosed under 50, that would warrant genetic testing. Now, let's say you're over 50 and you're diagnosed with cancer. Regardless of age, there are other factors that would make one meet criteria for for genetic testing. That being those who have a triple negative diagnosis. And that's just because those that type of diagnosis or that form of breast cancer is one that is more commonly associated with having a BRCA1 mutation, which I'll go over as well. Regardless of age, and your doctors are using this to make treatment decisions. So a lot of times, especially those with metastatic breast cancers, if you have a mutation within one of your genes, it could warrant being put on specific drugs that could help with your treatment decision. Another factor is somebody who's had multiple breast cancers, like maybe this is a second like recurrence, or maybe you were diagnosed in your right breast before but now have it in your left. Those are some things that would make you meet criteria. Somebody with a specific type of cancer called lobular breast cancer. So those who have like that as a personal diagnosis or family history with that. And then there's a specific type of stomach cancer, and that specifically is called diffuse gastric cancer, is one of those things that raises our suspicion. And once again, anybody with a male diagnosis of breast cancer. Now, these are just things that would make somebody with a breast cancer diagnosis meet criteria. But let's say you yourself don't have breast cancer, but somebody in your family maybe meets this criteria. That would also warrant you to do genetic testing. So let's say me, myself, I don't have cancer, but maybe my mom was under 50 when she was diagnosed. That would make you meet criteria. And ultimately, it's usually just when it's like a close relative. So your sister, your mother, or some other relatives. But once again, that's something that, a genetic provider would walk you through. Okay, so I've been talking a lot about genes. Well, what are genes? So let's just say we're all made up of thousands of different genes. And ultimately, our genes are everything that makes us us. It encompasses our DNA. And all of our genes have some different instruction for our bodies to tell us something to do. So, some genes, we always say like, oh, you got your mama genes, meaning like maybe you look like your mom because maybe, we have genes that literally tell us what we're going to look like. But the genes that I'm focusing on today are genes that usually they're supposed to help protect us from developing cancer. They're supposed to, help our cells to stop cancer from growing. And ultimately, the way they do that is they all have their own set of instructions that our brain is able to read, and it should read a certain way. And ultimately, what the genetic testing that I'll be talking about does, it reads your genetic makeup in several different genes, and lets us know if there's an alteration within that structure of the gene. So essentially, it's like a typo. I like to think of the genetic testing as doing a spell check to make sure things are spelled the way that we expect them to be. Okay, so there are different testing types that those of you who may have a breast cancer diagnosis, whether that be currently or years ago, may have undergone these different types of testing before. So a lot of this may sound familiar, especially like what is your HER2 status, or whether you are ERPR positive or negative or not. You may have heard of an oncotype or a mammoprint, for example. So those types of testings are very different than the genetic testing that I'm talking about today. Those are ultimately kind of what we think of to be genomic tests. And that's just because those type of tests are specifically looking at what are the genes specific to the tumor? What is causing your cancer to grow? Maybe how likely is that cancer to come back? Just based on that tumor testing. So ultimately, those tests may look like, when you're having biopsies or other surgeries, this type of testing will look specifically at your tumor. And those are kind of what we call like somatic mutations, which is just a scientific term for being specific to that tumor type, meaning it's not in the rest of your cells. It's not anywhere else in your body except within that tumor site where your cancer is. And those type of mutations can't be passed on. So those are things that are very specific to us and the cancer type. Now, the testing that I'm talking about is called germline, which is another scientific term for a mutation that's present within all our cells, meaning those were passed down from our parents to us, and we can pass them down for then our children and so on. So that's the type of genetic testing that I'm talking about. So once again, germline mutations can be passed on, somatic mutations cannot. Okay, so once again, I talked about earlier how, breast cancer is very common within this population, and most breast cancers are completely random. They just happen sporadically. Like, we know as humans, just the way we're made, that there is a chance for us to develop some type of cancer, and those are usually just sporadic. Now, once again, only 5 to 10% of cancers in general, with breast cancer being one of those, are hereditary. So when breast cancers are hereditary, that means that you have a mutation or one of those alterations within your genetic makeup that can be passed down. And one of these genes that you see here in this chart, and this is not an extensive list, this is just some examples. And a lot of you may have already heard of the BRCA genes. So that's BRCA1 and BRCA2, which are two different genes that usually make up the majority of hereditary cancers. So one may have a mutation in one of those. So those of you who may have already undergone genetic testing or just have heard about genetic testing as a whole may have heard about these genes. But as research has, continued to grow and genetic testing and technology has gotten better, we've found out about a lot more genes than just the BRCA1 and BRCA2 genes that play a role in hereditary breast cancers. So some of these other genes listed on here are just some of the other testing that one should be getting genetic testing for, because once again, BRCA1 and BRCA2 are not the only genes that cause hereditary cancer. So for those of you who may have had genetic testing, and maybe was, especially if you had it prior to 2015, it's possible that you did not have a comprehensive, what I would call, genetic panel, meaning maybe you weren't tested for all the genes that we can test for now. So for those of you who may have already undergone genetic testing, I would definitely start a conversation with your healthcare provider and say, do I need updated testing? And those of you who have not undergone genetic testing yet, the practice is primarily now to do a full panel just to make sure that we're covering our bases, because once again, a lot of these could contribute to hereditary cancers. So overall, what does the genetic testing process look like? So I can speak from a genetic counselor point of view, because that's what I do. So just what that session may look like, most of the times, your doctor may refer you to see, a genetic counselor. But you don't have to have a referral. Sometimes it could depend on what type of insurance companies you have, and the genetic testing office should be able to answer that question for you, whether or not you need a referral. If you don't need a referral to see most specialists, you probably don't need a referral to see a genetic counselor, meaning that you can refer yourself. And I'll walk through how to find a genetic counselor. But that first meeting will look like a 30-minute to an hour conversation, depending on where you go. And ultimately, my job is to walk through your history. So do you have cancer? What are your other medical issues or things that may be of concern? To walk through your family history. What are other things that would make me suspicious that you need genetic testing? And then ultimately, I want to provide you with all the information that I've really been walking through today, to really just give you an idea of what the testing is that you're going through and what it may ultimately look like for the future. And I'll go over that in a few slides. So once again, that first session is really just a 30 minute to an hour conversation, really just to give you some counseling as to what testing you're about to undergo and what that may mean for your health or for your family, and really just to get to make sure I'm testing for the appropriate things. Some people's family has more than just the breast cancer in there, and I talked about some of those other types of cancers that we can see. So definitely, depending on what cancers I may see occurring within your family may warrant what I want to test for, what I think you should undergo. So ultimately, after that conversation, and you're consented to doing the genetic testing, if you choose, some people go through the conversation and find out that this testing is not for me, this isn't something that I want to know. And that's really the purpose of that conversation, to make sure this is something that you want to do. This is not something that somebody with a breast cancer has to do. It's really up to you. And as a provider, I want to walk you through all your options. But for those who do decide to go through the testing, you would submit either a blood draw or a saliva sample. Doing it either way gets us the same result. I just always like to tell my patients, sometimes with saliva, we can have some sample failures if one doesn't submit enough DNA, or those of you who may be undergoing chemotherapy, sometimes we don't have enough saliva to build up when we're undergoing chemotherapy. So sometimes blood is just the better option, just because we don't get sample failures really with that one. So from that time, then it gets mailed to a genetic testing lab of that place's choosing. They really are all, there's different options out there, but certain institutions may want to use certain labs, have certain lab preferences over the other, but once again, they all get us generally the same result. And the results usually take about 3 to 4 weeks to come back. And once the results are available, your genetic counselor would get those, see if there's any background work that we have to go through, because I really want to understand your results and what that means to you, and for you and your family. And then ultimately, some institutions will either give you a call with your results and then make follow-up appointments from there. And I'll walk through what the results could possibly look like as well. And now I spoke from a genetic counselor point of view, but ultimately there may not be a genetic counselor in your area, and your healthcare provider does genetic testing. Now that's fine. It's just, I just want to make sure anybody who's going through genetic testing, you know what your blood is being drawn for, and you know what you're being consented to. So I just always make sure that you know what's going on with your health and with your visits. So now, what are the possible results that we can get? So if we get a positive result, that means that we found a mutation. So we found one of those changes within a gene that does increase risk for cancer. So now, for those who already have a diagnosis of cancer, that may explain, why you developed cancer. And for those who do not, there are things that we can do to prevent cancer or, catch one early, and I'll walk through that as well. But ultimately, I'll walk through the positive a little bit more. But if your results come back negative, that just means we didn't find a change. And it's possible that maybe just, your cancer is sporadic, one of those random occurrences, or maybe your family history just, there's a lot of cancer there, but we're just going to maybe treat it like a family history of diabetes, where we have to watch you a little bit more closely, but we can't find a hereditary cause to it. And we always say, genetics is always evolving. So continue to check in with your providers every few years to see if there's more testing available. But somebody with a negative result, you're going to continue screening, because that doesn't mean that there's no chance to develop cancer. It just means that we're going to manage you based off of your personal and family history. You could get something called a variant of unknown significance, meaning that there's a change within one of your genes, but we don't change management based on those. Sometimes we just have changes that are unique to us, that, as more research is involved, they really ultimately find out what does it affect on the gene. But that's not going to change your management, and that does not mean that you're at an increased risk for cancer currently. Okay, so what happens if I test positive and I don't have a history of cancer? So I'm just going to speak specifically to breast cancers, because I know that's what, generally we're all here for, but this could affect other cancers as well, depending on the finding. But just from a breast cancer screening point of view, that may look like increased screening options. So that may mean there's, usually people don't start mammograms till they're 40, just in the general population. But when somebody has a genetic mutation, we may start those earlier. And we may incorporate breast MRIs as well, just so that we're being extra diligent about screening, so that we can catch a cancer early if one were to occur. There are also risk reducing options. Depending on the gene that we find, they all have their different risks associated with them, and some are of higher risk. One of those being with those who carry a mutation in BRCA1 or BRCA2, we may talk about, undergoing a bilateral mastectomy, meaning to remove the breast so that we could prevent a breast cancer from occurring, which ultimately is the best way to lower your risk. And once again, there are other cancer screening or other risk reducing options for other cancers, depending on what we find. Okay, so what happens if I already have cancer? What is genetic testing going to do for me if I test positive? Aside from, it helping your family members, give information for them, because once somebody is positive in the family, other family members should do genetic testing, because if you remember what I talked about earlier, these are hereditary, meaning we likely got them from one of our parents. And that means that our siblings could also carry a mutation, as well as so could our children. But just from a personal treatment level, it may help you and your surgeons decide, what type of surgery am I going to do? Meaning, like, what is my ultimately, my risk for cancer, maybe developing in my other breast that I want to talk about different surgical options for. We talked about how there are certain drugs that one with metastatic cancer could go depending on what their gene status is. And of course, once again, there are other cancer screenings that we may want to talk about to prevent another cancer or a different type of cancer from occurring. So the big question here is, how do we talk to our family members to get all this information? And I know sometimes in our community, this is a hard conversation to start, especially depending on, which generation of our family members we're talking to. Maybe they don't want to share their information, or maybe they just don't know, because, depending on the generation, medicine has changed a lot from then. But ultimately, you have to ask questions. Somebody has to get the conversation started. And I know sometimes that can be awkward to have that conversation at the dinner table, or I only see this member at Thanksgiving. But there are ways that your counselor can help you navigate these conversations too, what to talk about, what to ask. But generally, you want to get your family member's medical history. What type of cancer did grandma have? Do you think it was in her stomach, her female parts? There's knowing, the more information we know, even if it may seem vague, can really help your healthcare providers know what to do and how to, help with your screening. And then ultimately, have your relatives already undergone testing. I get a lot of patients who, they think their mother or somebody in their family did genetic testing, but they're really not sure. Honestly, if you're comfortable, it's really best to share your results with your relatives, so that way that they can take that to their genetic providers, and so that they ultimately know what to rule out in one's family, or maybe if we need to test other people who may be more suspicious. So it's always very helpful. I always ask, my patients, like, do you happen to have a copy of your report? Because that really helps me know what genes was your mom tested for, and maybe do they need updated testing, and really what it warrants for that patient that I'm seeing there. And then, just like we talked about, talking to relatives, that also goes from us. So not just asking their history, but providing our own as well. If you're comfortable sharing your diagnosis with your family members, so that they know, this is now in our family. We have to be more vigilant about, your cancer screening. And just ultimately, because once again, your family history does help your providers knowing what to do next. And once again, if this conversation is a little hard to have, ask your providers for help. One thing that genetic counselors aren't just there to do genetic testing or walk you through the process. We really want to help you and your family members, get the most information, and we can even, help, jumpstart that. We may not call your relatives for you, but we may provide you with the resources of how to. Okay, so how can I receive genetic testing? So there is a website here called findageneticcounselor.nsgc.org, and that's just from our National Society of Genetic Counselors. There's, if you would go to this link, you could type in your zip code and, to help find a genetic counselor in your area. And then ultimately talk to your healthcare providers. A lot of people that may be doing genetic testing themselves may be, your gynecologist. Or maybe aware. And those are usually the people that also are, one of the providers that, we should see every year, if not every 2 to 3 years, that they, may already be doing your testing or like know where to pinpoint you. But of course, your primary care physician also can help, navigate where to go. But once again, most centers, you don't need a referral from your providers to go see a genetic counselor. So if you happen to find one and you just want to give them a call to make an appointment, you can do that. You can jumpstart the conversation before even talking to your providers, and they'll help you see whether testing is right for you. So these are just my references, and that's really all the information that I had for you all, but I know you all may have quite a few questions, and that might have been also a lot to process.
Well, thank you so much, Tatiana. That was very thorough and very informative. So we appreciate you sharing that information with our stakeholders, the women who are on here today. Before we, like Tatiana said, if you have any questions, please put them in the chat or in the question box, and we will make sure that we present them to Tatiana. We do have a few minutes to do that, so if you would be so gracious to do that. Just while you're putting a couple of questions in, I want to at least acknowledge a few of our chapters that have said that they're in the house. We have Chicago, we have Nashville, we have Charleston, Passaic, Bergen County, Detroit, the Triangle chapter, which is the Raleigh, Durham, and Central Virginia. And so we appreciate our chapter leadership and members being on board today. And we had a couple of survivors who were courageous enough to say that they have reached their 5-year and 2-year mark. And so, Sophia, we are continuing to pray for you as you continue to be well, and as you're hitting your 5-year mark. And then I think it was Chevelle who was 2 years out of New Jersey, and Sophia was out of Maryland. So we thank you for sharing that you have been in your survivorship for that amount of time. And Essex County is also one of our chapters that's in the house. So let's see, we in Greensboro. Okay, they're coming on now. They're letting me know. So Greensboro, thank you for being here. That's a great chapter as well. Again, if you have any questions, it says a question right here from Faith. It says, good afternoon. So my question, can someone have 2 different cancers at the same time?
Yeah, so that's a good question. Yes, someone can have 2 different types of cancers at the same time. And that would be a better question to ask, one of your healthcare providers, like, am I doing the appropriate screening just in general? Although it is more rare to have 2 different types of cancers at the same time. But once again, from what I talked about, really just lets us know if you had a hereditary standpoint to develop, any certain types of cancers. And once again, there are different screening options that we can do, not just for breast. If we were to find that you are at a hereditary increased risk for those cancers. And one thing I will say is somebody can carry a mutation in one of these genes and never develop a cancer. It just means that we're at an increased risk once we carry one of those. It's not guaranteed. So nothing is 100%.
Okay, so we've got some really good questions coming in, and I'll try to take them as quickly as I can. Someone said, you said something, this is Faith again. You said something about ages and birth and giving birth at early age causes cancer.
So I was just saying that just in general, just in the general population, just as women, there are things that just in general about 12%, there's a 12% risk for a woman to develop cancer. And there are certain things that can, make us at a more increased risk. Once again, and one of those major things where, like one of those things where when women develop their periods early on, it's one of those risk factors, not a high risk factor, but just one of those things that, can raise one's risk. And once again, that's why we take all types of personal and family history into consideration, regardless of what your genetic testing status is.
Okay, we have another question. Paulette says she was told that she does not qualify for genetic testing based on family history. First cousin was recently diagnosed with breast cancer. Does that qualify her?
Okay, so good question. Um, Once again, it could depend, maybe like on when you were diagnosed. But once again, so anybody can undergo genetic testing, even if like, and I will think we'll get to a place where anybody with breast cancer is going to be qualified to go undergo genetic testing. One of those things, it's just that will insurance cover it? So, depending on what your personal and family history may warrant whether genetic, your insurance is going to cover the genetic testing. I will say for most labs, the genetic testing is about $250 if you didn't go through um, your insurance. Let's say you just wanted to pay for it out of pocket. That's what it is generally. I know a few years ago it used to be thousands of dollars, so it's definitely come a long way. So once again, it could just depend on whether your insurance is going to cover it, not whether you can have testing yourself or not.
Okay. Just quickly want to acknowledge our Southeast Wisconsin chapter is also in the house. And we are going to put up a poll. If you would take this while we're continuing to answer questions, I would really appreciate it. We need 100% participation so that we can know that we are being effective in our programming and how we can, make things better for you. So let's get to another question. It says, is genetic testing counseling normally covered by insurance? If not, what is the average cost?
That's a good question too. So genetic testing. So from a genetic counseling standpoint, I will say a lot of insurance companies may cover the testing if you've had genetic counseling first. So I would look into that. But it could also depend on the institution that you're getting the testing at, because you could get a bill from that institution, which is very different from a bill from the lab that's doing the testing. And once again, most insurance companies do cover the cost of genetic testing, especially if you meet those certain criterias that I went over.
Okay. So this question is from Portia. She says, I was diagnosed in 1993 and genetic testing wasn't offered or available at that time. Is it ever too late to do it? Is it usually covered by insurance? And I think you just spoke to that. And so she's wondering, is it ever too late, basically?
Yeah, well, congrats on being a 29-year plus survivor. I will say it's never too late. Like, it's really never too late, no matter how old you are. If you meet criteria, you meet criteria. And if your family history is suspicious, your family history is suspicious. I will say, especially, yeah, since it wasn't available or offered, like I said, I'd say testing for BRCA1 and BRCA2 didn't really start to like the early 2000s. So yeah, so it's never too late.
Okay, another question. I am a 20-year breast cancer survivor diagnosed at 43. My sister is a 7-year survivor, also diagnosed past age 50. My daughter is 29. Her paternal aunt had breast cancer. Should she have the test?
Okay. I'm just trying to understand that. So you said that somebody was diagnosed under.
So it says, I am a 20-year breast cancer survivor diagnosed at age 43. Her sister is a 7-year survivor diagnosed at age 50, past age 50, excuse me. My daughter is 29. Her paternal aunt also has breast cancer. Should she have the test? I think meaning the daughter.
Okay, got it. Good question. So I will say something that always gives children the most information is if the parent is to do testing themselves. So you being diagnosed at 43, if you've never had genetic testing before, knowing what your testing status is would help your daughter from your side of the family. Because if you're negative, you can't pass on what you don't have to her. But like you mentioned, her paternal side of the family. So there's always two sides to every family. So I'm not really sure what age her aunt was diagnosed, or if I would be suspicious if there's a lot of cancer on that side of the family. But if her aunt has never done genetic testing before, genetic testing wouldn't hurt for her herself.
Okay. Another question. I have inherited my father's breast cancer gene BRCA2. I have stage 4 metastatic breast cancer. Can you provide tips to me to encourage my 32-year-old daughter to get tested?
Okay, good question. Okay, well, I would say, so it sounds like you've told her about your genetic status, and then that she should have testing too, because she now has a 50% chance of also being positive. Um, some tips that I would, really give to you is maybe to kind of find out maybe why she's hesitant to do genetic testing. She's right at the age where screening would have an impact on her. I know sometimes some younger generations are afraid about what the cost of the testing is, as well as how it will affect their insurance. So I will say, one thing that you could let her know is that healthcare insurance and employers cannot use genetic testing against you. So there's a law that's in place that can't have your healthcare insurance raise your premiums or change anything within your plan. The only thing is, when it does come to life insurance or long-term care insurance, those companies could see a positive result as a pre-existing condition. So sometimes just younger generations may want to have those insurance policies already established before doing genetic testing, if that's something that is a concern to her. Other things, I would tell her maybe just to go through the counseling process, just to maybe to get the information, and maybe that can help her decide when ultimately that she wants to do testing. Going through the counseling process does not mean you have to do the testing right then and there.
Okay. One other question is, how often should one have genetic testing done? And thank you everyone who's doing the poll, because we are at 81%, and I always strive for 100%, so I know that we can get there. So please continue to complete it if you have not had a moment. But how often should you, or how often is too often, or how much is too much, I guess is the real question.
That's a good question. So ultimately, it could depend on what you were tested for. I'd say if you've been tested within the past, 4 or 5 years, you probably have had all the testing that we would offer to you right now, just because it hasn't changed ultimately. But I would ultimately either call maybe who did your genetic testing in the first place and have them look at your report to see, like, are there more things that I could test for? And especially because I see this question coming up too, if you have a variant of unknown significance, always call. I say call within every 2 years or so if there's no updates about that. But I'd say every two or so years, just to see if there's updates. There may not be, and then you don't have, your genetics isn't going to change. So what you were tested for is what you were born with. So at this point, it's not something necessary that you have to do every year.
Okay. Another question is, if you don't know your family history, will getting testing without that information help?
Yeah, that's a good question. And ultimately, yes, I do have a lot of patients who, maybe don't know one side of their family, or just really have no information about the medical history because maybe they're estranged from family members. Doing genetic testing or even if you were adopted, doing genetic testing could, help when one doesn't know their family history. I'd just say the only caveat to that is sometimes, your providers may not know how to ultimately screen you if you come back negative, if you are at an increased risk for information that they don't know. But I think it's something that could definitely add a piece to the puzzle.
Okay, we have a couple more questions in a few more minutes, so I want to be very respectful of everyone's time since it is a Saturday. This question, I think you touched on it, but I'm going to read it just because she did take the time to write it. It says, thank you so very much. This was extremely informational and helpful. Question: I had genetic testing because I was diagnosed with breast cancer at the age of 49 in 2022. My genetic testing showed VUS for NF1 gene, which I believe can cause breast cancer. This breast cancer does run in my maternal family, and my BCR1 and 2 were negative. My maternal aunt too had breast cancer, was not tested for NF1. Do more Black people need to have the genetic testing for the NF1 gene to become not VUS?
That is a great question. So I will ultimately say, so having a VUS in a gene, NF1 is one of those genes that actually happens to have a specific characteristic. So I really would not be worried about if you don't have any of those other findings about your VUS. But ultimately, I will say we don't usually do testing. If you were to have a VUS, your family members don't have to get tested for that VUS as well. sometimes it does give them more information if they think that BUS is suspicious, but a lot of times they're not suspicious, and ultimately they get reclassified as benign. But to answer your question, do Black people need to have more genetic testing? Not just for the NF1 gene, but in general, the more that we test, the more they're able to ultimately say, maybe this just is a finding that's benign within our population and they just don't know it yet, because not enough of us are testing. So that is a great question. So yes, like testing does also, aid to research and science for us to ultimately get an answer as to, maybe this is just a change that we see more often in Black people and it doesn't have an effect on the gene.
Okay, so we have about 2 or 3 more questions. And again, this is the genetic testing. It's important to your health webinar presented by Sisters Network, Merck, and our partner For the Breast of Us. We thank everybody for joining us. And our Facebook Live friends are on as well, and they have some questions. So they are asking, let's see, what is this question? It says, one is, how often should someone get genetic testing? I think you just answered that, but you might just touch on it one more time. Another question from Facebook: if a family member is the first of the family to have breast cancer, should other siblings be advised to get the test done as well?
That's a good question. So yes, let's say, even depending on your family, your genetic makeup, even though we may share the same, family history or parents with our siblings, our test results won't be their test results. So every individual, should do genetic testing. So let's say my results were negative, but my family history is still suspicious. My sister should do genetic testing, because the more people that test in the family, the more information we're going to gain as to whether this is hereditary or maybe our family history is just, strong for cancer, but we're testing negative for a gene mutation.
Okay, last 2 questions. Does select genes identified after testing have recommended habit changes to counteract the negative effects of identified genes, such as diet, exercise, or medical recommendations?
Good question. So I always like to say cancer is very multifactorial, and we kind of went over those, but of course, diet and exercise always plays a role in that. So we always tell, anybody, regardless of whether you have a mutation or not, to maintain a healthy diet and exercise, because that not only can have an impact on, cancer risk, but just health in general. So I think that answered your question. I'm not exactly sure.
Okay, and this is our last question. If breast cancer is abnormal growth of cells, how can breast cancer become genetic?
Good question. So I would say all cancers are genetic in nature. They're not all hereditary. So ultimately, like you said, cancer is the growth of abnormal cells. And ultimately what can happen is, like I kind of talked about that tumor testing earlier, it could be just a mutation that happens specifically to your tumor that causes cancer to grow abnormally. Now, that's an alteration, once again, within a gene within that specific tumor that can't be passed on. Now, cancer can be hereditary if, like I said, if you carry a mutation in one of your genes that was passed on to you, meaning if having that mutation is putting you at an increased risk to develop a cancer, that's when it would be hereditary.
Okay. Well, we thank you today, Tatiana. You have been so wonderful and so informative how you presented this information. Again, this has been Sisters Network Breast Cancer, Black History Month, kicking it off, our patient education and empowerment webinar series, talking about genetic testing is important to your health. And again, Tatiana Garrison Johnson, who is just a young woman who's on a path to help everybody with their genetic information. We again thank you for taking the time to share your knowledge with our stakeholders. And we have a genetic testing directory that we are happy to make available. If you email Sisters Network, we will be happy to share that information with you. As far as this presentation, it is recorded and will be up again on our website as well as Facebook Live. So, I mean, not Facebook, but YouTube, excuse me. So please take a moment and re-watch it again, share it with folks. We want people to know more about genetic testing, particularly in the Black community, is so very important. And again, Sisters Network, we are about survivorship and sisterhood, and we celebrate it, and we've been celebrating it for nearly 3 decades as the national leader in the Black breast cancer movement. We are here to serve you. The ladies who were on this call, who are representative of our chapters, are here to help in your local communities. So just know that Sisters Network is a resource, and we are here to help. We thank you again, and everyone have a blessed Saturday and enjoy your Sunday. Thank you so much.